Hey, I'm Dr. Tina Edwards. I am a primary care doctor with World of Wellness Healing Care, and I want to introduce you to my new podcast, which is Lunch and Rant. So every week, I'm going to put out a new rant, usually about healthcare, and believe me, there are a lot of things to rant about in healthcare, but sometimes about other things, and I also plan to have some guest ranters, people who have impassioned views about something that I more or less agree with. I'm going to listen to what they have to say too, so I hope you enjoy. So to start the topic today, we're going to talk about prior authorizations in health insurance. So friends, you're out there spending anywhere from $700-800 to $1,800 or $2,400 a month to get health insurance. And the reason you're getting health insurance is because you want to be able to see a doctor and find out what that doctor wants to do for you. The problem is this. The insurance company makes their money by not giving you health care. And the way they do that is by impairing your access to your doctor or any tests or services your doctor may want for you. So they've started this process called prior authorizations. What that means is if your doctor wants to order an MRI or a CT scan or an ultrasound or even a lot of very common, actually quite inexpensive drugs, the insurance company will require a prior authorization. The purpose of this is to make the doctor so miserable they don't want to order it for you, or they encourage you to pay cash for it. And as it happens, a lot of the medications that you're paying $15, $20, $30, $45 copays for that are requiring prior authorizations actually cost no more than $7 or $10 or sometimes even $3. So as you can see, this is a process that's a little bit confusing, especially since I can get a CT scan for most of my patients' cash price for about $400. So it's a little hard to understand why your insurance company, which took in that much from you in that month, would need a prior authorization to get a study that your doctor says you need to get. Is the person deciding whether or not you can get that study a doctor? No. Sometimes it's reviewed by nurse practitioners, but in a major insurance company lawsuit, the medical director of the insurance company had to admit that when his nurse practitioners denied prior authorizations and gave them to him to sign, that he actually never read them, nor did he know whether or not he would have agreed with that decision. That, my friends, is called practicing medicine without a license. And that is happening all over this country with every single insurance company that tries to decide what your doctor can and can't do for you when you have a specific problem. In addition to preventing you from getting your care, it also takes the doctor's time. Usually what doctors will do is they'll hire a staff member to call the insurance company and fill out all the paperwork to get the prior authorization. But me, working in a direct primary care clinic, I do all of that myself. So guess what? I'm sitting on the phone for 20 or 30 minutes to get a prior authorization for something that won't cost my patient more than about $400. This is why so many of my patients are opting out of health insurance and going with health shares. Now, while health shares may have their problems, and we can certainly discuss those at length, the entire purpose of health shares is to actually pay for your medical care, and most of them have nothing like a prior authorization because the people who should be deciding on what you get for your medical care are you and your doctor. So, if you want to know more about prior authorizations, please feel free to email me, Google, text, comment on this post or on this on Instagram, and let's hear more about your experiences with prior authorizations and whether or not you can actually get the care that your doctor thinks you need.